Welcome to today's COVID-19 update. We're speaking with the Honorable Minister of Health, Dr. Frank Anthony. Minister Anthony, again, thank you so much for joining us.
Thank you for having me on the program.
Yes, sir. Let's begin with Bartica. We covered it yesterday, but any new updates as of this morning?
No, I think the situation in Bartica remains the same. We have 80 cases, and we continue to monitor. We have our team there. They're checking on the persons who are in self-isolation. And we have one person, I think, in the hospital. So they're monitoring.
All right. And yesterday we were talking about there's not the doom and gloom situation going on in Bartica right now. And you indicated that there will be new measures by this weekend.
So what we need, though, is that for people within Bartica to take additional precautions. We understand that there's still a lot of people who would go about shopping and so forth, and they're not practicing the COVID guidelines, meaning that they're not wearing their mask. In some cases, they're not doing social distancing. And we do understand that there might be a few businesses who, despite the order clearly states that you should not be opening drinking establishments, that there might be a few businesses that are non-compliant. So we are going to be looking more carefully, and if we find those businesses, then we are going to take some stringent measures. Because if people continue to go around and do things as per normal without following these guidelines, then these cases are going to persist. So the regional team and others who are managing the situation would have a serious look at what is going on. And they would be supported by us from the national team.
Okay. It's been a while since we spoke about persons coming into Guyana and possible imported cases. Are you able to tell us anything now in terms of how many cases we have had coming into Guyana?
Well, as you know, the protocol for us, we have put a protocol there for people traveling into Guyana where they're required to submit a PCR test. That PCR test, once it's within 72 hours of travel, then when you arrived at Chadijagan International Airport, you're allowed to proceed onwards. If it's more than 72 hours, then you're required to do a second test. And so that system has been working quite well. About 20% of the people who come into Guyana would require that second test. And of that 20%, what we know, we have so far been able to identify 16 persons who have been positive. So it shows that our system is working. And those persons who have been identified, obviously we would do the contact tracing. We'll inform the persons who have sat next to that particular passenger, the front, the side, and at the back, just to ensure that those persons are aware that there was somebody who tested positive who came on the flight, and therefore they ought to take quarantine precautions. So far, the team that has been monitoring this has reported good results. And we are going to intensify our efforts over the holidays because we expect a lot of people to be coming in. From our side at Port Health, we have increased the amount of staff that we have there, and we have put some other measures. So while we look for our health guidelines and so forth, we don't want to inconvenience people. So we're trying our best to have that balance of efficiency, but at the same time making sure that whatever public health guidelines ought to be respected, that it is respected. So we're going to continue to do that. We have done similar things at Ogle, and again, we have increased the Port Health team that we have at Ogle. And again, flights coming in there are basically subjected to similar scrutiny as those coming in at Jadijagan International.
Okay, Minister, early, as you mentioned, contact tracing. I know earlier on there was, it was a little bit shaky. Has it improved in terms of getting correct information from people coming in?
Well, people coming in, there's now a penalty if you give us false information. And so we also have added a new measure, and that is when you give us a number at the airport, we have phones that would be calling that number before you leave the airport just to verify that we have the right number. And by doing that, we have reduced the amount of false information that has been given to us. But even if you give us false information, that's a crime now, because we need the information so that we can help you to better understand, if there's a positive person that travel with you and so forth. And these are not only regulations that we have in Guyana. When we have somebody who has traveled from a destination to our country and they're positive, there is an international obligation, an international law, where we have to report those cases. And similarly, if somebody traveled from Guyana and they go to another country and tested positive for those countries that are testing at the airport, that information is conveyed to us. So there's a global system in place, and we are part of that system. So when people are positive, wherever they're coming from, their destination, we have an obligation to report these cases, and we have been doing that.
All right. If I can ask you, from the time the new administration came into government, I'm speaking specifically of the guidelines. Have there been an ongoing challenge with persons adhering to those, or are you seeing improvement as of now?
I think by and large, we have been able to raise awareness with a number of the things that are in the guideline. I think you can, if you go around and you do a random sampling of people, I think most people are aware that there is a disease called COVID-19 and what are the measures that you need to take. So awareness is very high. The challenge, however, is that sometimes while people have high awareness, they're not practicing the things that they know. And one way of preventing this is to use a mask. So although they know that this thing would help to prevent COVID-19, very often they sometimes don't use the mask. And that has been a challenge. How do you convert the knowledge that you have to change your behavior? And, we have to keep working with them. We have to keep talking to people. And those persons who understand why this is necessary would have to help us by spending some time in educating others. And I think everybody can do their little bit by talking to a friend, talk to a co-worker, and get them to understand the importance, because I guess we have all seen in our workplaces, there are people who would come in or who've been working there. They come from different backgrounds, environments. When they go home, when they go on the bus, and then they come to work the next day, you don't know how many persons they have been exposed to, whether they have taken ample protective measures, and whether they got sick somewhere or they got exposed to somebody who's positive. But when they come into the work environment, because you're colleagues and you have a knowing face in front of you, you feel less challenged to ask that person to, to do the right thing, because, is your friend, your colleague, or whatever. And that's the wrong attitude, because you don't know where they've been. You don't know who they've encountered. And despite, because they're, going back and forth, and it's the same with you. So unless people in work environments are able to maintain protection, we are going to see transmission occurring. And we have had these cases, you know. There are work environments where they haven't been so stringent, and then somebody tested positive, and then the whole office panics, right? And then we have to go test everybody and reassure people and so forth. That would have been prevented if we are constantly guided by the rules that we have, and if we utilize those rules, follow those rules, then we don't need to panic because we know we'll have minimum exposure. But I think we have to keep reinforcing this, and especially with the holiday seasons, I think a lot of people would want to reduce their guard, and that's going to be the wrong thing to do.
If I can take you to another topic, just a little bit off COVID, GPHC has a new board. It's a question I actually had from yesterday when we spoke about the Liliendal Hospital. What is your ultimate vision for one, Liliendal, the facility? I know when you came in, you did a lot of upgrading and so on. So what is the ultimate vision for that, one, and what is your expectation for the GPHC board?
Well, we have just installed a new board at the GPHC, so it's a big cooperation. It manages a lot of our tertiary care patients. And over time, we have had a number of challenges at GPHC because it's a busy place, and a lot of our patients are hospitalized there. On the near term, now that we have moved most of our COVID-19 patients across to the Ocean View facility, we have now been able to free up Georgetown Hospital to be able to return back to some sense of normalcy. One of the immediate things that the board has been tasked with is to ensure that we resume planned surgery, because we have a backlog that goes back from since March, and we'll want to ensure that persons who are on these long waiting lists now, that we start doing some surgery and start clearing that backlog. We'll be able to hospitalize patients and have faster turnaround because we are now using the antigen tests at the hospital. So rather than people having to wait in these transition wards for long periods of time waiting on a PCR result to come back, we can check to see whether what's their COVID status by using the antigen tests. And if we're not certain, then we do the PCR. But that would help us to screen a lot of patients and get them into the hospital and then be able to do surgery as quickly as possible. So we want to resume those set of services. Outpatient areas, we have repurposed a lot of the outpatient areas to put in the necessary things so that people can keep social distancing, sanitize, and so forth. So we have been doing that, but the amount of people coming into these clinics have dropped, and we have to make sure that those persons who are normally at those clinics, especially people with chronic non-communicable diseases, that they are receiving treatment and that their conditions are properly managed. Because these are the same set of people who would be at higher risk for COVID-19, and therefore we want to ensure that that happens. As it is too, there are a number of medication that are short at the hospital, and that too we're working over time to try to get that fixed. It's, you know, we're trying to source these things and make sure that we don't have shortages. But as we speak, there are still some items that are short. And the hospital and the board would have to take immediate measures to see how they can get some of this sorted out. On a more medium to long term, there are a number of projects that we plan to do at GPHC so that the hospital can keep improving its standards and expand its services and the repertoire of things that they are capable of doing there. GPHC also is the premier center for postgraduate training, and we are hopeful that in the near term we'll be able to fully operationalize the SuperSOD Clinical Center where we can do a lot of teaching and so forth for the doctors. So there are a number of things that we are currently looking at, and the board would be quite a busy board because they have a number of things to do.
All right. And Lillian Dahl, the Ocean View facility.
Well, at Ocean View, this is now going to be an annex to Georgetown Hospital. So in the near term, and until we have rid ourselves of COVID-19, that's going to be the place where a lot of our COVID-19 patients would go. So we have equipped Lillian Dahl so far to have a spectrum of patients from the severely ill to mild cases. And we are going to continue to improve that by adding laboratories and diagnostic facilities and so forth. So that's a near-term plan. What would happen in the future? There are about 3 or 4 options that we have discussed. We haven't confirmed which one of those options we will want to go with, but certainly that's something that we'll look at once we get past COVID-19.
Okay. I have one last question for you as we wrap up. With regards to the appointment of the specialist ministry team in preparation for the COVID-19 vaccine, are you able to say anything about the team, who's heading, what are the immediate plans and so on?
We have set up a national vaccine task force, and the task force really would be persons from the Ministry of Health and also some other persons who would bring the kinds of skills that we need. The task force, I would chair the task force because of the importance of what we are trying to do here. But it would have also persons who are familiar with immunization and vaccine programs. We have persons who we have trained, but they are in the private sector, who understand about cold storage and how to maintain refrigeration and things like that. So they're going to be part of the team. So what we have is a blend of people, Ministry of Health people who have the expertise. We have some other partners, like from the university, we have from the private sector, we have from the joint services, because in terms of the rollout and so forth, where we have to go, the rapidity and things like that to help us with logistics and things. And then we are also working to get a few expert immunologists on board as well. So it's a very diverse team, but all the members of that team are going to be absolutely essential as we plan and we roll out. So we have, while we're putting together that team, we have already started to do some work in this area because we have to develop a vaccine preparedness plan. So we have worked on a draft plan. And in addition to that, we have started working with COVAX to submit some of the things about possible vaccine candidates and our preferences. So those things have gone into COVAX about preferences that we will have for vaccines. And at the same time, we have also started to look at our cold chain, the places where we were going to store vaccine. We are working on expanding some of these centers to ensure that we have adequate space. And we have started the procurement process to get the types of refrigerators that would be necessary for the COVID-19 vaccine. We have also started developing a training manual, and that would then be used to train persons to administer the vaccine. As you know, this vaccine is a 2-dose vaccine, and therefore, once people get the first dose, they'll have to come back in some cases 3 weeks, depending on the vaccine that we're using, either 3 weeks or a month to get the second dose. So these are all things that we are working out, and to ensure that once we have the vaccine in place, that we can quickly roll it out.
Okay. Minister Anthony, as usual, it was a pleasure speaking with you. Thank you so much for joining us.
Thank you for having me.
Well, that's it for today's COVID-19 update. Of course, we just spoke with the Honorable Minister of Health, Dr. Frank Anthony. Remember, for more information, you can log on to our website, dpi.gov.gy, and of course, the Ministry of Health's website as well, health.gov.gy, and of course, our social media platforms.